Okay, let's go ahead. Do you hear me clearly?
Mm-hmm.
Okay. Okay, so imagine you are a 56-year-old male with oliguria 3 days after having kidney transplant. So I ordered labs. I found the potassium 5.5, sodium is
The
145.
potassium of 5.5, okay?
Yeah, sodium of 145. So I'm still confused. Your cyclosporin level is normal. So I ordered biopsy. Biopsy shows heavy lymphocyte infiltration and vascular involvement with a swelling of the intima. So what's best next step?
I think with this one, it will be to give a steroid, high dose steroid.
Yeah, IV steroid. Yeah.
Mm-hmm.
Now, if you are a 34-year-old male with severe abdominal pain and your pain is sharp and unbearable and located in the left lower quadrant, radial to the groin, what's best
Mm-hmm.
next step?
So this is stone.
Oh,
So
sorry. Yeah, so what do you? Sorry. Yeah.
mhm.
What do you do?
You can do non-contrast CT,
No, we start off
or you can
with
treat
ultrasound. You can,
wire ultrasound and not non-contrast CT.
yeah, you can do non-contrast CT or ultrasound. Both are good. But
Okay.
but how about if the patient is pregnant?
Or renal ultrasound, yeah.
Yeah, ultrasound. Okay. Okay. Imagine if you are a 50-year-old male with on exam there is a palpable purpura, hepatosplenomegaly, hematuria, RBC cast.
Palpable purpura.
Okay.
And what else?
Hepatosplenomegaly, RBC
Oh,
cast.
red blood cell
Your
cast,
your
okay.
your anti-HCV is positive. So what do you have?
Anti-Hep C is positive.
Mm-hmm.
So this will be nephritic. So nephritic, I'm thinking membranal proliferative.
So
Is it?
this one you have palpable purpura. This is most likely cryoglobulinemia, especially if you have joint pain too.
Oh,
So this
okay.
is mixed essential cryoglobulinemia and hepatitis associated with hepatitis C. Okay. Radio opaque stone on the left upper ureter. What type of stone is that?
Radio opaque.
Mm.
So I know that lucent will be uric acid. And so radio opaque will be like calcium oxalate, right?
Yeah, calcium oxalate. Yeah. Now, if you are
Or calcium pyrophosphate, calcium phosphate.
yeah, oxalate. Yeah. Now, if you are a 46-year-old male with intermittent severe right flank pain,
Right flank pain, okay.
yeah. So, what do you think is going on here?
You said he's a male,
Yeah.
intermittent right flank pain, stone again, nephrolithiasis.
Yeah, obstruction. Yeah. Any renal obstruction cause that, not just stone. Okay, now, if you have, that's a very tricky, and I like this question. It's a nice one.
Oh
But
my.
yeah, so if you're a 57-year-old who have a blood in your urine, and when I examine you, there's left-sided varicocele that failed to empty when the patient is recumbent.
Left-sided varicocele.
Yeah.
Mm-hmm.
Yeah. What's your
That
diagnosis?
fails. And this is 57-year-old.
Mm-mm.
Yeah, cancer, renal,
Yeah. Good job.
renal,
Yeah. Yeah. I can.
renal carcinoma.
Yeah. If I want to make it easier for you, I can give you hemoglobin is 18, platelet is
Mm-hmm.
600,000.
Polycythemia.
There's flank
Okay.
pain, hematuria, palpable renal mass,
Mm-hmm.
scrotal varicocele, left side, not right side. Okay.
Okay.
Thrombocytosis, anemia, erythrocytosis, fever, hypercalcemia, cachexia. Okay, that's the thing.
Mm-hmm.
Okay, what are the advantages of renal transplant over dialysis?
Of course. Oh my, what a question. So renal transplant will be better than dialysis. All right, I guess. Would you say that renal transplant they will have like a long-term survival than dialysis, and also quality of life will be better? I don't know. Yeah.
Yeah, better survival and quality of life. Okay.
What else?
Also anemia, bone disease, hypertension, better control with renal transplant.
Okay.
Okay. And interesting, like that renal transplant, they can survive. 88% they survive for 5 years. After more than 5 years, yeah. Now, this is a good one. Now, if you are a 55-year-old male, okay, who had a low back pain for 20 years that you're taking over-the-counter medication for it. When I ordered your urinalysis, I found white BC cast. What's your diagnosis?
Acute interstitial nephritis due to NSAIDs, what do you call analgesic nephropathy?
Yeah, analgesic nephropathy. So associated with long-term use of ibuprofen and aspirin. Usually asymptomatic, but they can have hematuria due to papillary necrosis. They have increased creatinine. Urinalysis shows sterile pyuria, hematuria, and can cause mild proteinuria. CT shows small kidney with bilateral renal papillary calcifications. Yeah, that's about it. Okay, let's go. So now, if you are a 72-year-old male who have increased frequency that cause you to wake up every 2 hours at night to urinate. When I examine you, there is enlargement of the prostate. So what is it going on here?
BPH.
Yeah. So you ordered urinalysis, and this is okay. So how do you manage hyperkalemia?
Hyperkalemia management. So I guess it depends on what is going on. If it's hyperkalemia with EKG changes, so you do IV gluconate. If there is no changes, you might not want to do gluconate. You can do insulin, Albuterol inhaler, all that. If it's a hyperkalemia, probably due to end-stage renal disease, if they have like kidney issues, you might want to do dialysis. Then if it's not that high, then you might be thinking doing like ASLS, because those ones take a little while for the hyperkalemia to go down.
Yeah, good job. Kexalate, dialysis, diuretic, insulin, glucose, sodium bicarb, calcium. Good job, yeah. How do you manage uric stone?
Uric stone.
Yeah.
So uric stone, I think because it's a uric acid, you want to do alkalinization of the urine, right?
So, yeah, so
That's all I remember.
Yeah, so what do you give?
You do a sodium, what do you sodium, is it sodium bicarb or something like that? You'd give them like a bicarbonate, to alkalinize the urine. I don't know what else you do.
Yeah, you give them potassium citrate to alkalinize the urine.
Okay.
Yeah. Good job, yeah.
Okay. Potassium citrate. Okay.
Oh,
all right.
Yeah.
Potassium citrate. What about the bicarbonate? Do you do bicarbonate?
What do you mean, like what is it?
You know, because bicarb is alkaline, is alkali. You can also use it to alkalinize the urine.
Maybe, yeah, maybe.
He said maybe. You don't know that.
Yeah, I don't know. Not sure.
Okay. All right. No
Never heard
problem.
like bicarbonate for uric stone. I don't know. Yeah.
So potassium citrate. Okay.
I don't know. Could be bicarbonate. I'm not sure. Yeah. So okay, what electrolyte?
Just 1 second. Let me, if you don't mind, let me go through my first aid and see, because I remember something from first aid.
Let's continue. Okay, so
Sure.
what electrolyte abnormality is contraindicated in succinylcholine for rapid sequence intubation?
Hyperkalemia.
Good job, yeah, hyperkalemia. So what can cause high anion gap metabolic acidosis?
High anion gap will be like your mod pals. Is it?
Yeah, what
Yeah.
else?
Mod pals like a methanol, uremia, DKA. P will be for propenyl ethylene glycol. Mod pals. I will be either ion or INH. L is lactic acidosis. E is your ethylene glycol, mod pals, and then S is salicylate.
Wow, look at you. I like it.
That was from step 1.
Good job. Yeah, I like you have good memory. Good job. Okay. Now, if you are 22-year-old male with dark urine that you just noticed and you had an respiratory infection 4 days ago, okay? Okay, now, so you should be able to know the diagnosis even if I don't tell you that there's RBC cast and there's,
Yeah, IgA.
yeah, the C3, C4 is normal, okay? IgA, yes. Post-streptococcal, they have decreased C3, C4, that's it. So how do you
Okay.
differentiate between PSGN and IgA nephropathy?
Okay. You just gave me some of them now. So one of them will be the duration of the infection. For PSGN will be about 3 to 4 weeks, and the IgA will be about 3 days, And then for also PSGN, you have a low complement. IgA deficiency, you have a normal complement. And I think those are the two big ones. What else?
Hmm?
What
So, yeah,
else?
IgA nephropathy most common in 20 to 30 years old. PSGN 6 to 10. Can I cover
6
that?
to 10. Okay.
Years old. Usually 10 to 21 days after infection. This one, the IgA, is 5 days. Sign of pharyngitic. Okay, both cause gross hematuria. Complement, IgA normal and C3 is low. There is mesangial IgA deposit seen in kidney biopsy on IgA. There's increased anti-streptolysin O or anti-DNase B in PSGN. PSGN have subepithelial humps. Okay, which is the C3. Prognosis, both are benign, have good prognosis. PSGN can cause chronic kidney disease if you have a really bad luck. Okay, while IgA nephropathy can cause rapidly progressive glomerulonephritis or nephrotic syndrome, which is terrible. I had my uncle. He had nephrotic.
Oh, really?
Yeah, I felt bad for him
Which
that he's
one?
had. Huh?
Which one?
Huh? What do you mean? Oh, I don't know, to be honest with you. Maybe it's the membrane. I don't know. I tried to figure it out which one. Couldn't. I did not have access to his medical records. I just know that.
Or in your country?
Yeah.
Or here?
No, it's over there. Yeah. So he's still. This is very tough. Like, yeah.
Hmm.
Oh.
Do you guys have this
Mhm.
what do you call it? HIPAA violation in your country?
Yeah, we do. Yeah,
Mm, okay.
we do. How about in Nigeria?
I don't know about Nigeria. Anything is possible in Nigeria.
Really? That's true. Yeah,
Third world country.
yeah. Yeah, I mean, the happiness comes from the inside. Like, if you're happy, you can be happy everywhere. If you're sad, you can be sad even if you're in heaven. Yeah, even here, there's a lot of depression and anxiety. Every 4 American, there's one of them have anxiety. So it doesn't matter even here.
I say in America everywhere.
Yeah, a lot of suicide also has been increased. Yeah, yeah,
Yes.
especially like
Yeah,
these.
because
Yeah, it's a lot of suicide and stuff. Okay, yeah. So if you're a 57-year-old woman,
hmm
you're very unlucky that you had a motor vehicle accident and you had a hypotension at the scene. Okay, so you have significant hypotension. I gave you fluid and stuff like that, but it looks like it wasn't good enough to save the kidney. So you had the BUN of 34 and creatinine is 2.2. Okay. So what's your diagnosis and what do you find on your analysis?
okay. So I am thinking maybe acute tubular necrosis.
Yeah. So what's your
Okay.
analysis finding?
Is it the you will see like muddy brown cast? Is that what you're asking me?
Yeah, muddy brown granular cast, acute
Mm-hmm.
tubular necrosis. Good job. Why? Because the BUN over creatinine is less than 20. So just
Right.
notice on that.
The
The
ratio.
the BUN is 34 and creatinine is 2.2. Okay, so this is indicate renal injury. Okay, as you know, the muddy brown is acute tuberous necrosis. Sorry, RBC glomerulonephritis, RBC cast, white BC cast, interstitial nephritis, fatty cast, nephrotic. How about broad waxy cast? What is that?
That's like a chronic kidney.
Wow, look at you, chronic renal failure.
I
Wow, good job.
I have a first degree before I went to medical school.
What is it?
Huh?
What is it? What did you say?
I said you know that I was what do you call it, a biochemistry major.
Ah, wow, that's why. Wow, so you study all of these things?
Yeah, we did.
Oh, nice.
That was a long time ago, though.
Nah, yeah, but still in there. That's good. Yeah. That's it. Okay, so if you're a 72-year-old male
hmm
with multiple contusion on the anterior abdominal wall and
Multiple contusion.
yeah,
Okay.
with a creatine kinase of 30,000. So what's best next step?
Okay. So hydration, fluid, rhabdo.
How about if the BUN is 78?
So BUN greater than 60, right?
Hmm.
Mm, I know where you're going to. What is it again? Yeah, that means that you're also like having some bleeding, right? GI bleed,
No,
or another type of bleed.
this is an indication for dialysis.
Oh, okay.
Gotta do dialysis. They have acidosis too. So what are the
They
indications?
have what?
Acidosis, like too,
Oh,
because
okay. The
so yeah. So
AEIOU.
yeah, what are the indications for dialysis?
So first one is acidosis, which is metabolic acidosis refractory to treatment. Then electrolyte abnormalities like hyperkalemia. I will be for like a injection of drugs that are not responding to treatment, like a overdose of like ethylene glycol, all those things, drugs. Then O is volume overload. That can be like a pulmonary edema, things like that are refractory to like, lysis, like treatments. And then uremia, like can be like pericarditis. It can be like encephalopathy, things like that.
Oh, okay, good.
AEIOE, right?
Good. Now, if you are an 18-year-old girl who's taking TMP SMX for a UTI, okay, so you came afterward with a maculopapular rash, creatinine of 2, and your analysis shows 2 to 5 RBC and numerous white BC cast with mild proteinuria. So what the hell is going on?
It has to do with the drugs that she's taking.
What is it for?
Bactrim. So she has a interstitial what do you call it? Acute interstitial nephritis due to Bactrim, due to the drug.
Yeah, it can happen due to non-steroidal too, penicillin, cephalosporin, cause maculopapular rash, new drug exposure, arthralgia, fever. Labs cause acute kidney injury, pyuria, hematuria, and white PC cast. Eosinophilia, urinary eosinophil. Okay. And inflammatory infiltrate too. So how do you manage it?
Stop the drugs.
Plus steroid, systemic steroid.
Yeah.
Now, if you're a 50-year-old male who has urinalysis of calcium oxalate crystals. Okay, so what should I recommend for you to decrease the risk of stone?
So I'm thinking the calcium oxalate crystals is coming from maybe taking like ethylene glycol poisoning.
Yeah, from calcium stone,
yeah. So recommend fluids, right? Yeah, fluids. It can also be you don't get calcium oxalate crystals from vitamin C, right? It's just from ethylene glycol, right?
And do you tell them to decrease sodium or decrease calcium?
Okay.
What do you tell them? Do you tell them to decrease?
No, you don't tell them to decrease the calcium because really,
yeah. So
I remember that I read somewhere not really calcium or protein, but more
three
like
things.
so you tell them to decrease oxalate, right?
Yeah, tell them three things.
Calcium is fine, really.
Tell them 3 things.
Protein is fine. IV fluid, a lot of IV fluid, hydration.
Yeah, we tell them 3 things. Number 1,
okay,
a lot of fluid. Second thing, decrease sodium intake.
Okay.
Third one, normal calcium intake.
Normal calcium intake, okay.
If you're a 65-year-old with blood in your urine, what's your diagnosis?
65-year-old.
Smoker with a painless hematuria.
Smoking. Yeah, likely bladder cancer.
Yeah, that's most likely a bladder cancer. Now, how do you manage potassium of 6.8 with peak T wave?
Calcium gluconate.
Yeah, insulin and glucose too. Now, if you are a 68 Caucasian male with left lower lobe pneumonia, okay, after drawing blood you have persistent bleeding BUN is 56, creatinine 3.5. So what is the cause of your constant bleeding?
I'm thinking maybe the patient has like a chronic kidney disease, platelet dysfunction.
Yeah, excellent. Good job. Platelet dysfunction. Yeah, wow, cool. So that is the end of renal system. Now we're gonna save that and go
I
to
was
the
so I was
endocrine.
so scared about renal.
Yeah, we did almost everything.